Hello dear student, welcome to GDC and welcome to Target Pharma 360 MCQ series specially designed for the upcoming pharmacist and drug inspector examination. So dear student, I am 𝘂𝐿𝐼𝐼 here and today I am dealing with the next part of your MCQ series and we are going to plan with the topic that is GIT agents, limit test and the dentifrices. So dear student, in this part we will discuss again top MCQ, top 20 MCQ from these topic. We will discuss few concept. I will tell you something extra point related to these MCQ. So please be there during all these session. Watch it completely. Now we will start with the first question, and first question is on your screen. That is, why are anti-flatulence combined with the antacid? There is two statement: anti-flatulent. Anti-flatulent means these are the drug that is used to prevent the evaluation of the methane and carbon dioxide gas, and these are basically combined with the antacid. So question arises, what is antacid? Antacid, as the name indicate, ant means against the acid. So these are the substance that is used to neutralize the acid in the stomach. Means these are the substance that is used to increase the pH of the blood in case of acidosis. Acidosis means if the pH of blood is going to be down from 7.38 to 7.1, 7.2, maybe any of the reason. So first option, why anti-flatulent are added? Just to increase the stability of the dose? No. To dispense the foam? No. To increase the absorption of antacid? No. Absorption of antacid, that is not the proper word. Even antacid, our non-systemic antacid are not going to absorb. Our systemic antacid, that is sodium bicarbonate or sodium citrate, they are going to be they are directly injected into the bloodstream. Whereas our non-systemic antacid, that is aluminum hydroxide, magnesium hydroxide, diazine, these are not going any absorption. They just do their effect locally, or we can say they just do their effect in the stomach cavity. Next option, just to minimize the effect of the evolved CO2. Yes, that is the right option. Anti-flatulence are combined with the antacid just to minimize the effect of CO2. Got it? Next question on your screen, second question we are having, which one is used as an protective in the GIT? Gastrointestinal agent, which of the following is used as a GIT? So we are having the option, that is the bismuth subcarbonate we are having. Secondly, we are having the zeolite. Third, we are having the magnesium sulfate, that is also known as the Epsom salt, and it is used as a laxative. So here is only the one option of the GIT protectant, that is the bismuth subcarbonate. Got it? Next question, which one is used as an cathartic? Which one used as an cathartic? As in the last question I had discussed, I had told you that magnesium sulfate, that is act as an laxative cathartic agent. Magnesium sulfate is also known as Epsom salt. Got it? So student, like the question here is one, but every option here is the next another question. Every option you will find one question, and there are four options. Four options are also the question for you. It is not like that I am discussing only the 20 question and you are getting only 20 options from the 20 concept. From these 20 question you will get 40, 50, 60, 100 of the concept from there. Next question for you. Which one is used as an astringent? So first you have to know, like, what is astringent? Astringent are the substance that is going to precipitate. They are basically applying topically. They can precipitate the protein. So here is only two options, like zinc sulfate and alum, that is all act as an astringent and the protective agent. Next question for all of you. Which of the which solution is used for the examination of the stomach and the colon? Here first we had discussed about this bismuth subcarbonate, that is the protective agent in GIT. Zeolite, that is also having the other action Magnesium sulfate act as an laxative agent, act as an osmotic laxative, also known as the Epsom salt. Here is the one option, that is the barium sulfate. It is also called as barium meal. Sir, how we can use? Students, suppose if any patient is having any type of injury in the colon, in the small intestine, like that. So the suppose this is the small intestine, this is the intestinal part of the patient. I'm just taking the example, don't take it seriously. So suppose it is the intestinal part of a patient, and like the patient is taking a drug like that. Patient has some type of internal injury, maybe that is undiagnosable. So there is a barium meal like that is coated with something. So if patient is undergoing any of the things now, and so what basically barium sulfate do? Like patient has been given a we can say dose, or has been given a meal type of things, and it goes into the stomach. From the stomach it goes into this small intestine and large intestine. Then after few times, the radiologist have to see, the radiologist what exactly they had seen. They had seen like they can pass the x-rays. Suppose the patient has taken the barium meal via any food or any other ingredient, any other formulation. So after going into the stomach, after going into the small intestine, large intestine, barium sulfate is not going any absorption in the small intestine. It is clearly visible if the patient is exposed to the x-rays. X-rays exposed to the small intestine or abdominal part of the patient, and radiologist can clearly see the small intestine, stomach as large intestine, where exactly the blockage is, where exactly the where exactly the blockage infection is there. Is there any plugging is there? Is there any extra food stucking is there? Is there any fecal matter is stuck there? So it acts as a contrast medium. Barium sulfate act as an contrast medium. It acts as a contrast medium. X-ray is not going to pass from the barium sulfate. Barium sulfate is not going any absorption in the small intestine, large intestine, and radiologists can easily examine the internal structure of the stomach and colon, and they can easily identify like what the problem the patient have. Got it? So barium sulfate, that is a solution also known as the contrast media, barium meal, used for the examination of these stomach and colon. And one another use of barium sulfate, like in the drug designing, or we can say in the research purpose. If someone want like their drug is undergoing the absorption, undergoing the disintegration and release in only in the large intestine. So what basically they are just doing, they just coat. Suppose this is a tablet, and the researcher just coat their drug with the barium. So they can easily examine where is the drug. Suppose if drug is undergoing the disintegration in the small intestine, if drug is undergoing the we can say disintegration in the stomach, so they can easily see where exactly the drug is undergoing the absorption, because the barium sulfate is undergoing the disintegration there. So they can easily visible if disintegration is start in the small intestine. So they can see, okay, there is a barium sulfate, there is a like there is a drug, there is the actual tablet. So they just have to make the modification among their formulation. Got it? Next question, the limit test of arsenic heavy metal is done by using arsenic. Remember these things, arsenic limit test is performed in the gut-jet apparatus. Gut-jet apparatus is used in the used for performance of the arsenic limit test, whereas our nasal cylinder is used as an to perform the limit test of your chloride, sulfate, our iron. Got it? And our lead limit test according to the IP is performed in the separating fluid. Got it? And arsenic limit test, there is a use of the mercury chloride paper, there is use of reducing agent like stannous chloride, zinc chloride, and HCl is used, and whereas lead acetate cotton plug is used. Got it? Next we are having the next question, which one is used as preservative? Which one is used as preservative? Got it? Which one is used as a preservative? So we can identify preservative like sodium benzoate, potassium hydrogen phthalate, magnesium sulfate, that is also known as Epsom salt, chlorhexidine, that is act as an disinfecting agent. So sodium benzoate, that is the mostly used as a preservative like the benzyl aluminum chloride in the we can say ophthalmic solution. Sodium benzoate is also in the emulsion formulation, suspension formulation. Next question for all of you, which one is used as an protective in skin? Which one is used as an protective in skin? So here is the option like the bismuth, magnesium sulfate, and the so calamine is used as an calamine. See na, calamine is used as an protective in the skin. So what exactly the calamine? So student, I hope in the B Pharma first semester, first year, you had made the calamine lotion. I hope everyone know the meaning of calamine lotion because this is the first practical. This was the first practical that I had performed in my B Pharma first semester. Calamine lotion, basically what we are taking in calamine lotion preparation, we are just taking the zinc oxide, iron oxide, glycerine, we are taking sodium benzoate as a preservative, and our calamine. So these are the basic ingredients that we are using to make the calamine lotion. So I hope you know, like calamine is having the color is somehow light pink color. Calamine lotion is having the light pink color. Sir, why the calamine lotion is having the light pink color? Even calamine is doesn't having the light pink color. Due to the iron oxide, calamine lotion is having the pink color. Question here is simply they are asking just what is the protective like which one of the following is used as protective in skin, and here are the four option and one single option that is correct, calamine. So you have to know each and every statement, each and every concept about the single word. Calamine, that is present in the calamine lotion, that is the zinc oxide, iron oxide, glycerine, sodium benzoate type of things. Got it? So these are the excipient in the calamine lotion, and iron oxide is act as due to the presence of iron oxide as an active ingredient, it is having the pink color. Got it? And next question we are having the which of the following is used as an dentrifices. So students, suppose anyone having no experience, anyone having the no concept regarding the dentrifices, but you know about this is the statement relevant to the teeth. Got it? So I had told you many of the time, if teeth and bone are in the question, they are asking anything about the teeth and bone. If the question is from the vitamin, then you have to choose vitamin D. If any of the minerals, you can choose the calcium. So here is only the single option where calcium is given. So dentrifices, the compound that is used in dentrifices, that is our calcium compound. So dicalcium phosphate act as used in the preparation of the toothpaste, act as an dentrifices. Next question we are having the next question, which of the following is white vitriol? White vitriol. So option is zinc sulfate, zeolite, magnesium sulfate, potassium alum, magnesium sulfate, that is also known as the Epsom salts. And white vitriol is our zinc sulfate, green vitriol. Green is our ferrous sulfate. And student, you just have to make the notes of these, na? Don't ignore these things, na? What is about the copper sulfate? Copper sulfate is our blue vitriol. Got it? So green vitriol, that is our ferrous sulfate, copper sulfate is our blue vitriol, and zinc sulfate is our white vitriol. So one question, multiple concept. One question, 4 option, 4 new concept. So zinc sulfate is our white vitriol. Student, you have to make your concept. You have to make, like if someone is asking about, someone is asking you, okay, what is use of labetalol? So labetalol, it is beta blocker. No, You have to know each and every concept about the labetalol. It is water soluble, not soluble? Is it having the any sympathomimetic activity or not? Having additional alpha blocker or not, like carvedilol? Having a, like labetalol is having a somehow use in the pregnant woman or not? uh, can we use as an emergency drug or not? So each and every concept you have to know about the labetalol. Got it? Same like someone is asking someone making the question to you, like can you please tell me about the emulsion? So you have to know about each and everything emulsion. It is not like that, sir, oil in water, water in oil. That is okay. There is a multiple emulsion option is also there. There is an emulsifying agent concept is there. Identification test of emulsion is there. If you had read any of the single term, someone can ask like, can you please tell me any anti-cancer drug? It is not like that, sir. Vincristine and vinblastine are the only anti-cancer drug in my knowledge. You have to know cyclophosphamide, mesna. You have to know declitaxel, paclitaxel. You have to tell them the cisplatin, carboplatin that are having the highest we can say vomiting inducing. They are vomiting inducing. You have to tell like ondansetron is also used in the management of the chemotherapy or cancerous patient, because chemotherapy drug, or we can say our anti-cancer drug are causing the nausea as a major side effect. Got it? You have to tell like if any person is taking indomethacin, that is our NSAIDs, but due to taking of indomethacin, that is for the pain, NSAIDs category means relieving pain, but the patient is taking the NSAIDs indomethacin, he or she have to suffer with the headache. Got it? So each and every concept in a diversity of way you have to think. Each and every concept you have to create the difference from your preparation and the other preparation now, because like suppose if five we can say five player are in the race, so one may have to make the difference to get the first position now. So you are also in the race of thousand and lakhs of the student. You have to make a difference with your preparation. It is not like that, sir, we will do after 2 months 3 months na, because there is a lot of like now the August month, September month is there, vacancy may be come in the February, January. No, each and every examination authority is giving only and less than 2 months time. In that 2 months they are just releasing the form, they are just taking the application from the student, they are just doing the screening, they are just allotting the hall tickets, they are just scheduling the examination also. So that is the right time to prepare for your preparation. That is the right time to prepare for yourself. It is not like you can wait for the 2 hours, 3 hours, 4 hours, months. It is not like this. Okay, sir, it's around 11 p.m. Now I can do early in the morning. And you had think early in the morning, like you had think, okay, it's 5 a.m. No, skip it. I will do in the evening. So don't skip your today's work to the tomorrow. There is no tomorrow. Every day is the today. Nah, tomorrow is also tomorrow is also the today. Got it? So don't skip anything on the tomorrow. Believe in yourself. Believe in today and prepare accordingly. Got it? Next question for all of you. Which atom works as an anti-caries agent? So basically this is relevant to your tooth product. So fluoride, that is the single option that is correct here. Next, megaltrate is a mixture of antacid and the mixture composed of. Megaltrate, that is a mixture of antacid and the mixture is basically composed of your antacid. Antacid, two major statement, that is aluminum hydroxide, magnesium hydroxide. Okay, magnesium hydroxide, that is somehow act as an that is somehow having the diarrheal effect. Magnesium hydroxide is having the diarrheal effect. Magnesium hydroxide is causing the diarrheal effect, whereas aluminum hydroxide is having the constipation effect. Constipation is effect is for the aluminum hydroxide. Magnesium hydroxide is having the diarrheal effect. So they can antagonize their effect. They like the side effect of constipation is neutralized by the diarrheal effect. Na? Got it? So megaldrate, that is a combination of aluminum hydroxide and magnesium hydroxide. Next, which one is intracellular electrolyte? Option you are having the sodium, calcium, chloride and potassium. So potassium is the one intracellular electrolyte. Next, a buffer shows its maximum buffer capacity. So maximum buffer capacity means that is equal to 1. So when pH is equal to pKa, the buffer capacity is equal to 1. Next, like the major storage form of iron, so that is apoferritin, ferritin, transferritin and alpha glycoprotein. Alpha glycoprotein, that is the plasma protein, that is our albumin and your glycoprotein. So these are the we can say protein and amino acid. Apoprotein, that is the immature protein, immature albumin, alpha glycoprotein, that is the amino acid, protein, and apoferritin, that is the somehow transferritin, that is the transporter protein. So basically iron is transporter iron, act as a transporter carrier. Ferritin, that is the storage form of the iron. So basically absorption of iron, and you have to tell me absorption of iron. Absorption of iron, in the comment box you have to tell me absorption of iron is from which part of small intestine. Like folic acid is going to be absorbed maybe from the duodenum. You have to tell me from where the absorption of iron take place in the body. Yes, this iron form is like Fe3 positive is converted into the Fe2, ferric form is converted into ferrous, and ferrous form is undergoing the absorption. Got it? So you have to tell me the absorption site of iron in the small intestine in human body. So ferritin, that is the storage form of iron. Next question we are having, calamine contain. Calamine contain. So I had discussed the same in the previous question also. Calamine contain basically zinc oxide and ferric oxide. Due to the ferric oxide, the calamine is having the pink color. So pink color of calamine is due to the ferric oxide. Nice question, no? Next, you are having the hydrogen peroxide is generally not used as anti-infective for. Hydrogen peroxide is somehow having the highest antimicrobial, having the toxicity action on the body. So dermatological infection, yes, we can apply topically. For ear infection, we can insert into the into the body cavity in a very little amount. Yes, ophthalmic solution we can use in a very low concentration, but systematically hydrogen peroxide we cannot give because it creates toxicity in the human body. So systemic effect is intolerable for the use of the hydrogen peroxide. Next question you are having, which one is used as an cathode in 𝘂𝙎 counter? These are basically 𝘂𝙎 counter is basically the radioactive instrument, radioactive measurement instrument, radioactive protection and production part. So here cathode rays, cathode tube, cathode is made up of iron and basically coated with the silver. So iron sheet that is coated with the silver that is used to make the 𝘂𝙎 counter. 𝘂𝙎 counter. Next you are having the inorganic scintillator used for the gamma radiation counting is. Inorganic scintillator that is used for the gamma radiation counting. Gamma radiation counting, inorganic scintillation is used, that is sodium iodide. Sodium iodide. Sodium iodide is used in the gamma radiation counting, is used in the inorganic scintillation. Next question for all of you, which of the following reagent is used to preserve the chloroform during the storage? Which of the following reagent is used to preserve the chloroform during the storage. So you have to tell me the option answer fast. So chloroform, that is a reagent, like a reagent that is used to preserve the chloroform, that is the ethanol. So ethanol somehow less reactive, ethanol somehow less toxic than the methanol, phenol and propanol. So this is the reagent that is used to storage of the chloroform. So student, we had discussed it next top 20 questions from the GIT agent, from the dentrifiasis, from the limit test, somehow 1 or 2 questions we had included from the radiopharmaceuticals. So you have to watch the next part of your Target Pharma 360 test, 360 MCQ series, that is only and only designed for you student. We are the whole team of GDC that are working day or night to provide the best and best content. It's your duty also to pay back us by securing a good rank in the upcoming pharmacist drug inspector examination. So please be patient with the test with the MCQ series of Pharma 360. Please be there every day on the scheduled time. Please watch each and every video. Ask your questions in the comment box. Ask your queries with the technical team. Visit GDC Classes app that you have to download from the Play Store. We are planning each and every day to provide the best and best content. So it's your turn that your success is our success. Your exam is our exam. So it's your responsibility to do hard work in a very disciplined, in a very honest way. Got it? So thank you so much, everyone. Stay connected with me and GDC. All the best for your examination.